So this is a short case, but an interesting one. This is a gentleman that came in 2005, came after having a stapedotomy in 2005 on his left ear and had a persistent conductive hearing loss, had a revision stapedotomy, kind of a classic finding of a lot of scar tissue within the middle ear. Prosthesis appeared to be a little too short. And so we redid that on the left side. And then he had a stapedotomy then done on the right side. And you can see mixed loss on the right, left side has a persistent conductive loss after the stapedotomy. And again, this gets to your point, Brian, if I didn't do his first stapedotomy and I did a CT scan, I found no superior canal dehiscence, no third window effect, no large enlarged vestibular aqueduct, nothing that could be accounting for a loss. Even though it's not a classic pattern of loss, I still check for that. And I had a very heart-to-heart type conversation with them about, do you really want to hear well? Because he was very much opposed to even wearing hearing aids. So the scan shows very significant ring signs around both cochlea, indicative of far advanced otosclerosis. On exploration, the round window was open on the left side and on the right side, but it's a mixed loss due to far advanced otosclerosis. So just one more piece of information. We had the otosclerosis study group meeting 2 weeks ago at the American Academy of Otolaryngology, which, by the way, we had live. We were able to drink wine together and share stories and cases. And 0 of 25 surgeons was used an osseointegrated device on this patient. And I think the concern was there's no evidence to support that with any form of cochlear breakdown that the device would be effective. And I can tell you that we've got an experience with right about 8 or 9 patients, which is not certainly a series, that shows it's quite effective. We've actually seen boosting of the bone line just with a Baja 5. And we found that to be a very nice option for these patients. So I like to throw it out to the world and get more of a global opinion.
Leonard.
I think there's the left ear, I think is the easier one, where we can be sure that the bone conduction threshold is true. And so to go for a bone conduction device probably is a good option there. Now for the right ear, one can question whether the bone conduction threshold is really right, because we have this problem of the bilateral mixed hearing loss, and then to do a right audiometry. So would be, I would say, probably might be poorer. And then, of course, the question is, what could you do on the right ear? So a conventional hearing aid, yes, it might be so, but still the amount of amplification you need in that patient is quite high. So the question is also coming up whether we could go for a cochlear implant on the right ear, depending on what the patient might get with the conventional hearing aid. So that's what I could comment to that case. The other one is, of course, to try to do stable surgery on the right ear, but you already did it. So, and there was probably not a lot of success with, or not what you expected. And this could be due to the fact that that you already closed the gap and the bone conduction threshold is not correctly measured.
How many people bring a bone conduction option into the initial discussion for otosclerosis when you talk about treatment options? And have you seen a change in uptick for that?
No, I think most people would rather not have any kind of device to manage. If it's a mixed loss, I would be more apt to scan and make that available to them. But I've had very few takers.
Dr. Rigg, you had raised your hand there. You're offering that?
Yeah, we routinely offer for any stapy surgery. We offer do nothing hearing aid, bone conduction devices, or exploratory tympanotomy with or without stapedectomy. Invariably, most patients prefer to have the stapedectomy as a choice, but you need to discuss risks, benefits as well. And some nowadays, being more informed and being more internet savvy, then want to go for transcutaneous devices. When you compare stapedectomy with percutaneous devices, the uptake is much lower because of looks. But with transcutaneous, with no risk of to the middle ear or hearing and the connectivity, there is an uptake now.
Yeah, Brian, I did a revision of the rehabilitation for the patient with mixed hearing aid a few months ago, and I couldn't find more than 10 papers talking about that. The truth is, when you have a gap higher than 30 decibel, probably the patient go better with a bone conduction system. So we do tests in all of these cases, and the test is with a hearing aids and then with a bone conduction system, and the patient say which one prefer.